Good afternoon, everyone. Salam, peace to everyone. Bonjour. As the Executive Director of Human Concern International, I'm pleased to be here. My name is Mahmuda Khan. I stand before you representing the first Muslim charity established in Canada in 1980. For the past 2 decades, more than 20 years, HCI, we have been dedicated to working in Palestine, implementing very significant, important humanitarian projects in Gaza that span support for orphans, medical treatments, water, sanitization, health facilities, educational institutions, and building homes. Our commitments to the people of Palestine, especially those in Gaza, has been unwavering. Yet today, I speak to the government of Canada with a very heavy heart as a Muslim Canadian. And it is an urgent appeal to all of Canada, especially our Canadian government. On October 13th, Canadian Charities, as a part of the Humanitarian Policy and Advocacy Group under Cooperation Canada, we penned a letter to the Minister of Foreign Affairs emphasizing the need for safe space and safe access for humanitarian goods and demanded respect for international law. Subsequently, on October 20th, 10 Canadian Muslim charities, including ours, reached out again to the Minister of Foreign Affairs. Our collective plea was very clear. We were demanding immediate and permanent ceasefire and the establishment of, again, for safe corridor for humanitarian aid, which should be uninterrupted for life-saving delivery to be entered into Gaza. It's imperative to clarify the Canadian government's call for a humanitarian pause does not align with the collective demands of Canada's charitable sector. Why? Because the situation on the ground is far worse than many can fathom. The devastations we witness today in Gaza is unparalleled. It is indiscriminate in attacks, and also the sheer magnitude of the loss. It's just total and completely all anguish what's happening there. No place in Gaza is safe, not even for the humanitarian workers. Our very own frontline humanitarian workers are in grave danger. Some had gone missing. We don't know where they are. Our warehouses where we're storing life-saving, goods have been bombed, and we have been losing the homes we have built, water wells we have built. Schools and hospitals are being attacked where we have supported for many, many years millions of dollars in aid, all destroyed in just several days. Yesterday, we received a call from one of our aid worker who lost a family member who just went simply out looking for food for the family. He was waiting for hours outside a bakery, and that bakery was bombed, and we lost him. These are messages we're receiving on a daily basis from our partner, from the aid worker, images and videos that I can't even open anymore. My heart as a mother, I just can't open these messages we're receiving on a daily basis, hourly. With over 7,000 deaths, including almost 3,000 of them children, women, elderly, sick, 15,000 injured. These are just grim numbers, and these are stats that we see everywhere. But please remember, these are not just numbers. These are human lives we're talking about. As we focus on this conflict, we cannot forget the pre-existing healthcare crisis. Over 6 hospitals have been seized. They had to cease their operation due to fuel scarcity. 29 hospitals are not able to keep up with the demand. Let me put some perspective here. There's 2,000 cancer patients, 1,000 individual depending on dialysis, 130 premature infant, pregnant women that are not receiving the medical care they need due to this crisis. As a humanitarian organization, we're witnessing firsthand how Canadians are expressing their views toward the ongoing war through their generosity, despite the facing challenges, the economic challenges that we have here, that the families here are facing. Canadians are donating at levels that are remarkably high. For us, surpassing contribution made during other crises this year. This surge in donation is a clear message from the Canadian public urging our government to take swift and strong and decisive action to save lives. Our immediate task is clear: to safely deliver aid, reconstruct hospitals, schools, water well, homes. Sheer scale of devastation demands nothing less than immediate ceasefire and comprehensive solution to save lives. Our immediate ask once again is clear. We need a permanent ceasefire. A humanitarian cause. A pause is not the answer, and we need safe space for humanitarian worker, humanitarian corridor to get life-saving aids inside Gaza. Actually, just before getting here, I was getting messages from the ground that mothers are writing names of their children on their hand. So if they're bombed and they're scattered and they're separated from the family, they could track them down. This is what's happening. We can't even imagine. As Muslims, we feel sometimes worried to send our kids to school. That are they going to be bullied? Are they going to be, attacked just for being Muslim? But imagine these are mothers who are thinking that, am I going to wake up and have my kids alive? Let me write their name on their arm so that they're traceable. So this is the situation in Palestine. This is inhumane. We can't even think about it. So please write to your MPs, call your MPs, and anything in your capacity, reach out to the government and demand an immediate permanent ceasefire. That's what we need as humanitarian aid workers. Thank you so much.